Members of the civil society organizations and students' unions aren't happy with Edo State government over compulsory vaccination. Well, they have staged a massive protest against the policy of no COVID-19 vaccination, no entry into public places. The protesters, who grounded vehicular and human movements in major parts in the metropolis, asked the government to share COVID-19 palliatives and not the vaccine. Babajide, sharing the palliative instead of the vaccine. Let's have your thoughts about this. Nigerians' attitude towards receiving the jab. What can be done to convince Nigerians that this vaccine is for our own good and not otherwise?
You see, they were not simply saying share palliatives. They were saying we need security in Edo, not vaccine. We will resist any form of executive rascality. Hunger killing us, not COVID-19. Those are some of the messages that the placards they were carrying bore. But you see, the first time when this story was first reported that the governor of Edo State had decided that vaccination must be compulsory and made up his mind to bar people from entering public places unless they were vaccinated. I remember that we opposed the idea. Not that we don't want our people vaccinated, not that we do not see the value in vaccinating people. But you see, it is clear that in public health, such terminologies as compulsory, mandatory, enforcement, and all that do not work. You must find an effective modality to communicate your message using persuasion to bring about some form of behavioral change. Gentle persuasion, showing superior argument. That way, you'll be able to convince people that, look, it is for their own good. To simply say those who refuse to get vaccinated are endangering the lives of other people. At a time when only 4.6 million Nigerians, at the last count, had been vaccinated by the federal government. At a time when, even if all Nigerians were prepared to get vaccinated, we have no means of making that happen. Because how many doses of these vaccines do we even have access to? So there's a problem there. Even if Edo people, if all of them said, okay, today we want to be vaccinated, that governor has no means
to vaccinate everyone.
To vaccinate even 1/4 of the Edo people. He can't, if they made up their mind, he cannot. Let's even be generous. You say, okay, 1/4. I'm saying, if all of Edo people
I get you.
say they want this vaccine, he has no means by which he can vaccinate even 1/4. And it's so shameful that Edo State, UBTH, is described as the headquarters of community medicine in our country. Professor Okoje, who heads that unit, is one of the best doctors in the world. He's a world-class physician. So to now hear that this sort of problem is happening in that part of the country, that state, that physicians see as the capital of community medicine in our country, is something that bothers me. You simply can't. The federal government too wanted to come up with this kind of idea. Remember, 6 states, including Ogun State, said no. We would rather persuade our people. We will not force our people. Ogun, Cross River, And the rest of them, they said no. They let the federal government realize that they will not be interested in using force on their people. So I think that the governor did not really, he did not take the right decision, and now we are facing some sort of embarrassment, because if they start picketing government institutions now, they have said that this is just a warning, that these protests that ensure that they locked up major roads in Benin, that is just the beginning. Because of what? Other states have said, look, we will not violate the rights of our people. We will simply appeal to them. I'm telling you, even in the UK, I remember Manchester United, one of their goalkeepers caught the virus. And pressmen asked the manager, is it that you've not vaccinated all of your players? The manager said, there are some players who have refused to be vaccinated, and we can't force them.
You can't force them.
That is the thing. You can't force them. Their bodies belong to them. As much as it makes sense, you get the point. We are not against it. It makes sense for everyone to be vaccinated, but we are saying that persuasion is better than attempting to force people. Because it will not work.
Doctor, do you share the same sentiments with persuasion as alternative to...
I do really. I do really. Because like Biku also said, in setting out to make something compulsory, then it means the thing is available. That's just the logic.
Right.
When it's not available and you say it's compulsory, then you are standing logic on its head. It means the governor did not do his own work well. It means those who advised him, except he's one of those governors who believe that every decision starts and stops on their table. Otherwise, it's a very wrong decision to have taken. What he has now done with this protest is that he has now even exposed the state to more danger, because these things spread faster in gatherings.
No.
That's what he has done. So why don't you just, in taking decisions like this, ensure that the people understand what the issues are? If you observe, since the governor came under fire, you now see them reporting the processes of their COVID-19 team in Edo State. Before, it was almost nil. You weren't hearing anything from the state. Nobody knew people were dying at that level. But it came under fire now, and then, so people should be enlightened. They should know what the situation is. Every day now, you must read in the newspaper, read it online, hear it on the radio and TV. So number of people have died. These were the circumstances. These were with places. You need to provide information so that people themselves say, oh, so this is really happening.
I know that it means well, but
this
method is not going to work.
All right, let's quickly take this call from Jos. Ahmed, please go ahead with your contribution.
Hello, good evening.
Good evening, Ahmed. You're live. Please go ahead.
Yes, I'm calling from Jos.
Yes, we heard you. Go ahead.
Yes, I want to talk about, let's get back to the Kanu issue that people have spoken about earlier. I can't imagine somebody was telling which crime Nnamdi Kanu has committed. I hope if the table turn around, another person come up with a agenda in future, that person will still stand at his position.
Hello, Ahmed. It seems to have lost connectivity. Yeah. Apologies there, but if you can call back, we will take your contribution. So, Babajide, Dr. rightly mentioned, understanding the severity of the virus perhaps is key to, ensure people understand why they need to take the vaccine. But what other measures, needs to be done to perhaps persuade the people to know that, it's not all that bad to take the vaccine, but, it's for your own good and for the good of others around you as well?
Some of the steps that have been taken in the West we don't have the financial wherewithal, because they give incentives to get vaccinated.
They give incentives to workers.
What kind of incentives? Let's
even monetary incentive. Monetary incentive you get. Yes.
In some places, you bring your certificate and you get employment.
So
if you don't come with it, you won't.
So you think that should work in this case?
No, I'm saying that we can't. That's not practicable here. Let's not talk about what we cannot. The level. Look at the level. We were given palliatives here to people, but what did we do? We didn't even manage it well. But over there, look at this kind of money that the Trump administration committed to easing the pains of the people as a result of the
lockdown
pandemic. Because people lost their jobs. And Nigerians too, tens of millions of Nigerians too lost their jobs. But did they get any form of
palliative
support? Because simply giving people a bag of, a carton of Indomie, it's not supporting the real sense of the word. Yes, when are they? In no time they've
exhausted it.
Children who are at home, who are not in school, they eat a lot more.
Yes.
You are a mother, you know what I'm talking about.
Of course I do.
They wake up at midnight, eat bread, go back to browse, come back again.
You won't even know when they eat the food.
Yes.
You'll be asking the question, how did this happen in
Yes,
this house?
there is a disused refrigerator in my wife's room. That's where she puts bread. Bread is 650 for God's sake.
You can't eat it anyhow again.
He moved from 250 to 650. In under one calendar year. So you put it there, it will sneak in,
grab it,
put it there. They will think that she's already completely lost in sleep, you see. Who is that? But instead of the boy to go back and drop the thing, he will just quickly open the door. Because others are waiting.
Others are waiting.
So this is the thing.
For the goods to arrive.
The point I'm making is during the lockdown, children who are not in school, for the parents, they got to spend a lot more on feeding.
Yeah.
So what is the level of support that Nigerians got during this time?
Do you know that in some states in the US, during that lockdown, children were at home. They told the children where to come, centers for their parents to bring them to collect
rations.
Because some of them, they were giving them lunch in school, so they will make a week's ration available to them to take home. So they had no problem. But can we afford it?
We don't.
We cannot.
Our economy can't support
So
that large scale.
No, we cannot. The kind of thing we can do now is to ensure that we run our economy well. That's the kind of thing we should.
Let's quickly take this call from Niger State. Umar, please go ahead. You're live.
Good evening. You're speaking with Etsu Umar. I'm calling from Mina, Niger State.
Right, go ahead.
Thank you, Babadide. I want to personally appreciate you for your work. Well done. Many of us from the north here, we're always happy seeing you because we really appreciate you.
Thanks.
I want to talk about this sit-at-home issue that is actually going on. Babadide, many of us were not happy in the north, and just like as what you said, maybe use who will to really handle it. We are not happy seeing the council and stay in the but what we are saying, they should also consider what is actually going on. There are people who are actually this issue of poverty is everywhere. Everybody feels marginalized already. If you come to Niger State, look at how many of us are not happy the way the government, the federal government, the way they are treating this issue of people with blood for the past 4 days. I want you to do a special package on that. Right now, they block the trailers, block the road for the past 4 days now. So If we talk about the vaccination, you have said it all, Babajide. They should not force anybody. It shouldn't be compulsory. It should be just will. If you are interested to do it, you should do it.
Yes.
Thank you very much. We want to appreciate your TVC program, Babajide. Thank you.
Thank you. We are grateful. Great our Niger people.
So what would you have to say about what he just posited earlier on, Babajide, with regards to the vaccination now? You know, you mentioned rightly said that, you know, perhaps incentives like monetary incentives will do, but, you know, in our case, we can't really, you know, do so much. But, you know, what would you suggest that needs to be done so that, you know, people get to...
The enlightenment, even the enlightenment has to be better.
Right.
For example, how much enlightenment are we doing? Enlightenment is not simply to put something on TV. It's not everyone who has access to TV.
Right.
Enlightenment can even involve moving from street to street or going to major street to say, look, this is what government is doing. You've got to support the government. This is for your own good. Get people can speak in the language that people understand, different languages. Because a lot of our people are illiterate. They don't even understand these issues. Look at the lies that people are peddling about COVID-19 that is getting people to see COVID-19 as something designed to take our lives. So there's a lot of enlightenment that we also need to do. When we exhaust that fully, honestly, we will see some level of improvement. But let's even improve in terms of access to this vaccine. Let's improve that, so that those who are interested, at least they will be vaccinated. But we don't have enough. We don't have enough. The governor of Edo State has to stop this ridiculous order that he has made, because it will not work.
Doctor, final thoughts?
Yes, my final thoughts. I've said this on this program about 2 or 3 times. Just the last point BKO made. We need to improve on access to the vaccines. And the best way out is for us to get serious in this country and get approval to produce.
Indeed. Well, that's a fine place to live it, gentlemen. Many thanks for your insights. Babajide Kolade Otitoju and Dr. Oladipo, as usual. Thank you very much for your insights on the show this evening.